You might be in first year BDS or are just entering it and are wondering, how do I be successful in BDS? So this video is for you. We'll be discussing 5 points you need to consider to be successful during your first year of BDS. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. The first point is acceptance. If you're among the few who took BDS as his first choice, I would advise skip this point and move to the second. But if you are from the majority who gave the NEET exam thinking I will get into MBBS and had no option, then took BDS, then this part is for you. You would be anxious and excited about joining BDS, but there would be some amount of sadness that you missed out on MBBS. You'd be looking at your friends and batchmates who might have got into it. And you're wondering, what if I would have studied a bit more? What if I could have given NEET exams once more? If you want to be successful in BDS, you have to forget that. You have to move out of the NEET zone and get into BDS wholeheartedly. A lot of people out there would tell you BDS might not have scope. But trust me, the majority of people who do BDS with entire sincerity and continue with dentistry are successful. And for that, you have to give it your whole and soul focus. So accept your situation and move forward thinking that I am going to be the best dentist out there. There are 1.3 billion Indians and I need only 4 or 5,000 of patients to be successful, and I am going to achieve that. So once you accept that BDS is for you and you're going to do it sincerely, the next step is to adapt. You might have shifted to a new town or a new area to join a dental college and you're confused about how the things are around you. There's this fear whether you will blend in, whether you do really well. So you have to initially focus on adapting. For doing so, you can do 2 things. One is look inward and second is look outward. What do I mean by that? I do not mean by looking inward that you should become isolated and only study. I mean that go to your roots, talk to your friends, connect with your relatives. You might have habits or hobbies which you enjoy. Keep doing those so that you do not feel distant from the new surroundings. And by looking outward, I mean explore. Imagine you're a tourist in a new area. Go meet new people, learn the language, try the cuisine. There'll be at least 50 to 100 new batchmates. Talk to them, interact, go around your college, and eventually you'll find your bearings. Because once you're adapted to the entire situation, the BDS becomes more easy of a journey. If you keep yourself distant and disconnected, you'll have difficulty throughout your entire 5 years. So adapt to the new situation. The third thing you need to focus on is time management. BDS is different from your 12th standard or your junior college. Here, you'll have multiple things which you need to keep focusing on. That would be studies, keeping up with the latest things in college like your freshers, your cultural days. You'll have quotas which you need to complete. You'll have internal exams. You'll have your final exams. So balancing all these becomes difficult. So learning time management is an important skill. For that, you can learn Heisenhower's metrics. You can know Pareto's principle. You can focus on batching. We've discussed more about this in our book, The BDS Launchpad, that is about achieving success in a dental college. You can pick that book and read it as well. The fourth thing is studies. What happens when you're busy with adapting and accepting a new situation? You tend to forget on studies. Suddenly the internal exams are here and you just cramp up whatever you can so that you pass. But what happens is you get into this vicious cycle where you're just studying to clear the exams. Remember, you're no longer in 12th and whatever you study here is going to be extremely important. For example, your first year consists of subjects like anatomy and dental anatomy. Anatomy forms the basis of everything you're going to do during dentistry and even when you're treating patients. Things what you learn in dental anatomy will help you in your 4th year in prosthodontics, conservative dentistry, and in treating patients' oral cavity. One tip here is you'll have a lot of clinical quota, for example, carvings. Learn the concepts as you're doing them. Yes, you might take help from your friends of how to go about it, but do not outsource work because these form the basics of your clinical skills which you'll be using for your life. So getting your basics right, where you understand all the concepts, is important. And for improving your studies, there's one technique I always suggest, that is active learning. After you watch our video, go and check out that video on active learning. That is a technique which helps you study things faster and remember them longer. Before we move on to our fifth point, if you're liking this video, do not forget to hit the like button and share it with your friends who are in first year BDS. If you stick to the end, there's a surprise where I'll give you a bonus tip. The fifth point is mental and physical health. What happens when you're in a new place? You tend to stress about it. I have seen a lot of people undergo the 5 kilo syndrome. What is the 5 kilo syndrome? In the first year, maybe you're anxious, maybe you're stressed out, and you tend to overeat. What happens? You might end up putting on 5 kilos weight. And if you're those who have a tendency of losing weight, maybe because of the work you're going through, you might end up losing about 5 kilos. So you do not want to end up there. Now maybe you're staying in the hostel and you have the freedom to stay awake as much as you want. So do not spend a lot of sleepless nights, which affects your health in the long run. Having good mental and physical health helps you in succeeding in BDS in the long run. And for those of you who have stuck till the end, the bonus tip, which I think is very crucial, is have a bird's eye view. What happens is most of you are focused on just graduating through BDS. So you're looking at exam to exam. You're like those horses with blinders, not looking at things in dentistry other than just your studies. But that does not make you successful. So you have to remember, BDS or dentistry is an entire field. It is not just studies. So you should know what is going around throughout it. For example, what are your options after BDS? If you plan to go abroad after BDS, what you're supposed to do? How do other dentists become successful? All these things are encapsulated on our page, Kaizen Dental. So do not forget to subscribe to it. Other than that, you can join various organizations like the IDA, which gives you an overview of what is happening throughout the entire field. Before we end, do not forget to go and check that video on active learning or go and buy our book, The BDS Launchpad. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.